Once upon a time, the healthcare systems in the United States and Canada were envied around the world. With cutting-edge technology, groundbreaking medical research, and comprehensive care, people enjoyed some of the best health outcomes globally. However, over the years, both nations have witnessed a decline in their healthcare systems, leading to what many now describe as a health crisis. In the mid-20th century, the U.S. led the world in medical innovation. The introduction of Medicare and Medicaid in the 1960s aimed to provide health care for the elderly and low-income families. Canada, with its universal health care system established in 1966, promised health care for all its citizens, eliminating financial barriers to access. However, several factors have contributed to the current crisis. In the U.S., the rising cost of healthcare, driven by pharmaceutical prices, administrative expenses, and an insurance-based model, has left millions without coverage. In Canada, funding constraints, aging infrastructure, and a shortage of healthcare professionals have resulted in long wait times and reduced access to care. Let's look at the current challenges in more detail. In the U.S., nearly 30 million people remain uninsured. Even those with insurance often face high deductibles and out-of-pocket expenses. The high cost of medical care forces many to delay or skip necessary treatments. Emergency rooms are overcrowded, and medical debt is a leading cause of bankruptcy. In Canada, the universal health care system struggles with long wait times and limited access to specialists. Personal stories highlight the human impact of these challenges. John from New York shares, "I had to wait 6 months for a critical surgery. I felt abandoned by the system." Meanwhile, Sarah from Toronto says, "I had to travel to Germany for my surgery because the wait time in Canada was over a year." Other testimonies include Maria from Los Angeles, who had to crowdsource funds for her cancer treatment, and David from Alberta, who had to drive several hours to see a specialist for his heart condition. According to recent data, the U.S. spends more on healthcare per capita than any other country, yet it ranks poorly in terms of health outcomes. In 2021, the Commonwealth Fund ranked the U.S. last among 11 high-income countries in terms of healthcare system performance. In Canada, a 2020 survey by the Canadian Institute for Health Information revealed that 30% of Canadians wait more than 2 months to see a specialist. Additionally, rural Canadians are 50% more likely to report unmet healthcare needs compared to their urban counterparts. Given these challenges, many are seeking medical treatment abroad. Countries like Germany, India, and Thailand are becoming popular destinations due to their high-quality yet affordable healthcare services. While seeking treatment abroad can be beneficial, it also comes with challenges. Patients often face cultural and language barriers, potential risks of complications during travel, and the difficulty of managing follow-up care. However, the cost savings and access to timely, quality care make it an attractive option for many. It's time for policymakers to prioritize health and ensure that everyone has access to the care they need. Share your story, raise your voice, and demand better healthcare today. We need to act now to restore our healthcare systems and ensure a healthier future for all.